Okay, so imagine this. It's 2 a.m., you're a parent, and your kid wakes up with this, like, barky cough. Almost sounds like a seal trying to sing opera, you know.
Yeah.
Instantly you're thinking crip right.
Oh, yeah.
Well, today we're diving deep into common childhood illnesses. But we're going a bit beyond just, the surface level stuff. We've got some fascinating research and insights here that'll hopefully give you, like, a fresh perspective.
Oh.
And maybe a little bit more confidence the next time, your kid spokes a fever or wakes up with, like, gooby eyes or whatever.
Right. Yeah. It's about understanding not just what these illnesses are, but like how they fit into the bigger picture. Your child's developing immune system. We'll explore when those like watch and wait approaches are totally fine and when a call to the doctor is like absolutely warranted.
Exactly. So we've got research articles, some expert opinions, even a few anecdotal stories from parents. We'll start with that pink eye dread, conjunctivitis. I vividly remember having this as a kid, and the whole classroom basically turned into a petri dish. What makes it so incredibly contagious, especially in those like school and daycare environments?
Well, think about it. Kids touch everything and then touch their eyes. Then they touch other kids. It's a perfect storm for spreading those bacteria or viruses. Plus, their immune systems are still learning, so they're more susceptible to those infections in the first place.
Yeah, makes total sense. Now, our sources mention that pink eye can be bacterial, viral, or even allergic. Is there any way for parents to tell which one they're dealing with at home? Because I know a lot of folks rely on that old green mucus means bacterial, but I'm guessing that's not always accurate, is it?
Yeah, you're right to be skeptical. Discharge color can be misleading. One study we have here actually found that in non-newborn cases, it's really the combination of symptoms that matters more. So, for example, if you see eye pain along with the redness and discharge, that's a stronger indicator of bacterial conjunctivitis, which usually needs those antibiotic drops.
Interesting. So it's not just about one symptom, it's about looking at the whole picture, which I think is a helpful takeaway for parents. Now, switching gears to those dreaded ear infections, otitis media, our sources highlighted how a child's ear anatomy makes them much more susceptible to these infections compared to adults. Can you unpack that a bit?
Sure. It all comes down to those eustachian tubes, those tiny channels connecting the middle ear to the back of the throat. In kids, they're shorter and more horizontal, making it tougher for fluid to drain. Creates a cozy breeding ground for bacteria.
Ah, so it's like a poorly designed drainage system, leading to all that fluid buildup and pressure. Now, I know a lot of parents get anxious about potential hearing loss or speech delays from recurrent ear infections. What does the research say about that?
Yeah, no, that's a valid concern, and it's one reason why careful monitoring and sometimes prompt intervention are key. One study from the Journal of Pediatrics found that while most kids bounce back from a few ear infections without lasting issues, those with frequent, severe, or untreated infections are at higher risk for those developmental delays. That's where early intervention like speech therapy or hearing evaluations if needed can really make a difference.
So early detection is key. Now, you mentioned treatment. Is it always a straight shot to antibiotics, or are there other approaches?
Not always. There's actually been a shift in thinking about antibiotic use for ear infections. Remember, many are viral and just need time to, run their course. Plus, overuse of antibiotics can lead to resistant strains, which nobody wants.
Right, that antibiotic resistance issue is a real concern.
Yeah.
So what's the approach now?
It's more nuanced now. Doctors consider factors like the child's age, severity of symptoms, and whether it's a first-time infection or a recurring one. Sometimes a watchful waiting approach is used, especially in older kids with mild symptoms. This means monitoring the child closely and only starting antibiotics if things worsen or don't improve after a few days.
So it's about finding that sweet spot between addressing the infection and avoiding unnecessary antibiotics. Now, this deep dive also included some alternative therapies parents are trying. What's your take on those?
Well, that's where things get really interesting. Some parents are exploring, things like chiropractic care or osteopathic manipulation, which focus on improving drainage and reducing pressure in the ear. There's even some preliminary research suggesting probiotics might help prevent recurrent ear infections by bolstering the immune system.
Wow. So it's not just about treating the immediate infection. It's about potentially addressing underlying susceptibility as well. That's a thought-provoking concept for parents to consider.
Exactly. It's about understanding that, each child's immune system is unique and there might be different paths to supporting its development.
Speaking of supporting the immune system, let's move on to the common cold, that frequent visitor that just seems to love daycare and preschool classrooms?
Ah, yes, the common cold, caused by over 200 different viruses. It's no wonder kids can get so many of them each year. They're practically little germ magnets.
And I've heard that the average kid can get 6 to 9 colds per year. Is that accurate?
That's pretty accurate, especially for kids in group settings. Think about it. Their little hands are everywhere. They're still learning about hygiene, and their immune systems are, being challenged and strengthened with each new exposure.
So it's like boot camp for their immune systems. And I'm guessing there's no magic cure for the common cold, is there?
Unfortunately, no. Most colds are self-limiting, meaning they'll run their course in about 7 to 10 days. The key is supportive care. Fluids, rest, and maybe a cool mist humidifier to help with, congestion.
Okay, so no need to rush to the doctor for every sniffle. But when should parents be concerned? What are the red flags that warrant a call?
Good question. Things to watch for are prolonged fever, worsening symptoms, or signs of like a secondary infection. So for example, earache could indicate an ear infection, or difficulty breathing could be a sign of bronchiolitis.
So it's about knowing what's typical for a cold and when those symptoms cross the line into something potentially more serious.
That's right. And remember, parental instinct is powerful. If you're ever truly worried about your child, it's always best to, err on the side of caution and consult with your pediatrician.
Absolutely. Now, before we move on to the flu, I want to touch on a common misconception about colds. That whole green mucus means bacterial infection thing. Is there any truth to that?
It's a persistent myth, but not very reliable. Mucus color can change for various reasons, even just from exposure to air. What's more important is the overall picture. How's your child behaving? Are they eating and drinking? Is the fever manageable?
So it's about looking at the whole child, not just obsessing over mucus color. Okay, let's move on to the flu, influenza.
Now, the flu is a whole different ballgame. While it shares some symptoms with the common cold, the flu tends to hit much harder and faster. You often see a sudden onset of fever, chills, muscle aches, and that feeling of being utterly wiped out.
Okay, so it's not just a bad cold, as some people say. It's a distinct illness with a potentially more severe course.
Exactly. And while most healthy kids recover from the flu without complications, it can be more serious for those with underlying health conditions or weakened immune systems. That's why flu vaccination is so important.
Now, I've heard some parents express concerns about the flu shot. What's your perspective on that?
I understand those concerns. It's natural to, be cautious about anything we put into our children's bodies. But decades of research have shown that the flu vaccine is safe and effective. It significantly reduces the risk of getting the flu, and for those who do get sick, it often makes the illness milder.
So it's about weighing the potential risks and benefits, and the evidence overwhelmingly supports vaccination. Now, our sources also mention something intriguing about the flu. That getting a cold can actually make kids more susceptible to the flu. Is that true?
That's a fascinating point. And research is starting to shed light on, why that might be. A recent study found that a rhinovirus infection, one of the main causes of the common cold, can actually alter the immune system's response, making it easier for the influenza virus to take hold.
Wow, so it's like the cold weakens the defenses, creating an opening for the flu virus. That's a good reminder for parents to be extra vigilant during cold and flu season.
Absolutely. Taking steps to prevent colds like frequent hand washing, avoiding close contact with sick people, that can indirectly help protect against the flu as well.
Okay, so we've covered pink eye, ear infections, the common cold, and the flu. Up next, we'll delve into sore throats, tonsillitis, and that scary sounding but often manageable condition, croup. But before we do, I'd love to hear from you, our listeners. What are your biggest anxieties when it comes to these common childhood illnesses? What questions or experiences do you want to share? Keep those thoughts in mind, and we'll be right back. We'll continue our deep dive. Welcome back to our deep dive into common childhood illnesses. Before the break, we were talking about how colds can actually make kids more susceptible to the flu. It's like, one infection weakens the immune system and leaves the door open for another.
Yeah, that's a great analogy. And it's a good reminder that, these illnesses are all connected in a way. It's not just about treating individual symptoms, but understanding, how they impact that overall development of a child's immune system.
That makes a lot of sense. And it brings us to another common ailment that often pops up during those cold and flu seasons. Sore throats. We've got some info here on pharyngitis and tonsillitis, two terms that, sound kind of intimidating, but are actually pretty common in childhood. Can you explain the difference between those two?
Sure. Pharyngitis just means inflammation of the pharynx, which is like the back of the throat. Tonsillitis, on the other hand, refers specifically to inflammation of the tonsils, those little lumps of tissue at the back of the throat that are part of the immune system.
Okay, so tonsillitis is kind of like a subset of pharyngitis. Now, I remember having my tonsils out as a kid, which was not a fun experience. Is that still a common procedure, or has the thinking changed on that?
You're not alone in that memory. Tonsillectomies were much more common a few decades ago, but thankfully the thinking has evolved. Doctors are much more conservative now, reserving surgery for cases where it's, truly necessary.
So when would a tonsillectomy be considered necessary? What are like those red flags?
Well, there are a few key indicators. One is recurrent strep throat, like 7 or more episodes in a year, or 5 or more episodes each year for 2 consecutive years. That kind of pattern suggests that the tonsils are chronically infected and not effectively doing their job.
That makes sense. So it's not just about the number of infections, but also the frequency and severity. What else might warrant a tonsillectomy?
Another red flag is massively enlarged tonsils, sometimes called kissing tonsils because they practically touch in the middle. This can obstruct breathing, especially during sleep, leading to snoring, pauses in breathing, which is sleep apnea, or even difficulty swallowing.
Wow, so it's not just about sore throats. It can actually impact breathing and overall well-being. Are there any other situations where a tonsillectomy might be considered?
Yeah, sometimes the adenoids, those other little lumps of tissue near the tonsils, also become enlarged and can cause similar problems with breathing or drainage. In those cases, an adenoidectomy or removal of the adenoids might be recommended, often done at the same time as a tonsillectomy.
So it's about addressing any obstructions or chronic infections that are, impacting the child's health and quality of life. Now, let's talk about treatment for sore throats in general. I know a lot of parents wonder about antibiotics. When are those necessary, and when can you take a more watch and wait approach?
That's a common question, and the answer, as with many things in medicine, is it depends. If the sore throat is caused by a virus, antibiotics won't help. In fact, they can do more harm than good by disrupting the gut microbiome and potentially contributing to antibiotic resistance.
So how can parents tell if it's a viral sore throat or something that might need antibiotics?
There are some clues, but it's not always easy to distinguish, based on symptoms alone. Viral sore throats often come with other cold symptoms like runny nose, cough, congestion. Bacterial sore throats, particularly strep throat, are more likely to cause high fever, swollen lymph nodes in the neck, white patches on the tonsils, But the only way to know for sure is to have a throat swab tested.
Okay, so testing is key, especially for strep throat, which I know can have some serious complications if left untreated. What about those viral sore throats? How can parents help their kids feel better while they ride it out?
Oh, there are lots of things parents can do to ease the discomfort. Warm liquids like soup or tea with honey for kids over 1 year old can soothe the throat. Gargling with salt water can also help reduce inflammation. And over-the-counter pain relievers like acetaminophen or ibuprofen can bring down the fever and reduce pain.
Good old-fashioned home remedies can go a long way. Now, shifting gears to another common childhood ailment, croup, which I think is every parent's nightmare because of that distinctive barking cough.
Yeah.
What causes croup, and why does it often seem to get worse at night?
Croup is usually caused by a virus, most commonly parainfluenza virus, and it tends to affect younger children, typically between 6 months and 3 years old. It's characterized by inflammation and swelling of the larynx and trachea, the upper part of the airway, which is why you hear that harsh barking cough.
Okay, so it's the inflammation that's causing that sound. But why the nighttime worsening? I've heard theories about cooler night air or lying down making it harder to breathe. What's the thinking on that?
Well, there are a few factors at play. One theory is that the cooler night air can trigger spasms in the airway, making breathing more difficult. Another possibility is that lying down can increase mucus buildup in the already inflamed airways, leading to more coughing and congestion. And of course, there's the psychological aspect. Kids are often, more anxious at night, which can exacerbate their symptoms.
That's probably a combination of all those things. Now, our sources mentioned that while croup can sound terrifying, it's usually manageable with proper care. What are the go-to treatments?
The mainstay of treatment is corticosteroids, usually a single dose, which work wonders at reducing inflammation and opening up those airways. Sometimes, for more severe cases, nebulized epinephrine, bronchodilator, is used to quickly relieve the airway constriction. But thankfully, most cases of croup resolve on their own within a few days with supportive care at home.
That's reassuring to hear. Are there any, home remedies parents can try to help ease the symptoms.
Absolutely. One tried and true method is taking your child into a steamy bathroom. The moist air can help loosen mucus and soothe the airway. Cool mist humidifiers can also be helpful. And sometimes simply holding your child upright and comforting them can make a big difference.
Okay, so supportive care and a calm environment can go a long way.
Mhm.
Now, we've been talking a lot about respiratory illnesses, but let's shift gears to something that can be equally concerning for parents. Rashes.
Yeah, rashes are definitely a source of anxiety for parents. They can be so varied and sometimes, difficult to decipher. But remember, most childhood rashes are harmless and self-limiting, meaning they'll go away on their own with time.
It's good to hear. But I know there are some rashes that are more concerning than others. How can parents tell the difference?
It's all about looking at the context. What other symptoms are present? How does the rash look and feel? Where is it located? And how long has it been there,
Yeah. Okay, so it's about paying attention to the details. Now, our sources mentioned a whole bunch of different rash types. Viral exanthems, bacterial infections, allergic reactions. Let's start with the viral ones. What are some key things parents should know about those?
Viral rashes are incredibly common in childhood, and most of them are, nothing to worry about. They're often a sign that the body is fighting off a virus, and the rash itself is simply a symptom of that immune response.
So the rash is actually a good sign, in a way. It means the immune system is doing its job.
Exactly. And while they might, look scary, most viral rashes are harmless and self-limiting, meaning they'll go away on their own without any specific treatment. The focus is really on managing any discomfort, like itching or fever.
Are there any, specific viral rashes that parents should be aware of?
Definitely. Roseola, for example, is very common in babies and toddlers. It typically starts with a high fever, which can last for a few days, followed by a distinctive pink rash that appears as the fever breaks.
Okay, so high fever, then rash. That's a good one to remember. What about hand, foot, and mouth disease? I've heard that one can be pretty contagious and uncomfortable.
It can be, yes. As the name suggests, it causes blisters on the hands, feet, and in the mouth. It's highly contagious, especially in young children, and spreads through contact with, saliva, blister fluid, or stool.
So good hand hygiene is crucial for preventing the spread of that one. What about those bacterial rashes? Those sound a bit more serious.
Bacterial rashes are caused by a bacterial infection of the skin and usually require treatment with antibiotics. Impetigo, for instance, is a common bacterial skin infection that causes sores and blisters, typically around the nose and mouth. It's highly contagious and can spread through close contact or by sharing towels or toys.
It doesn't sound fun at all. Are there any other bacterial rashes that parents should be aware of?
Cellulitis is another one to watch for. It's a deeper skin infection that can cause redness, swelling, warmth, and pain. It can be quite serious and requires prompt medical attention.
Okay, so any signs of cellulitis warrant a trip to the doctor. What about allergic reactions? Eczema seems to be on the rise these days. What can you tell us about that?
Eczema, also known as atopic dermatitis, is a chronic condition that causes dry, itchy, and inflamed skin. It's not contagious, but it can be very uncomfortable and often requires long-term management.
Why does eczema seem to be so much more common now than it used to be? I've heard theories about everything from environmental factors to changes in diet. What's the thinking on that?
It's a complex issue, and there's no single answer. There's definitely a genetic component. But researchers believe that environmental factors like pollution, allergens, and exposure to certain chemicals play a role as well. The hygiene hypothesis suggests that our modern obsession with cleanliness might be backfiring, depriving our immune systems of the necessary exposure to microbes that help them develop properly.
That's an interesting perspective.
Yeah.
So it's not just about genetics, it's about the interplay between our genes and our environment. Now, let's talk about managing eczema. I know a lot of parents struggle with, finding the right treatments. What are some of the most effective approaches?
Well, the cornerstone of eczema management is moisturizing. Keeping the skin hydrated is crucial for preventing flare-ups. Gentle, fragrance-free moisturizers are best.
So it's not just about treating the inflammation, it's about restoring the skin's natural barrier function. What about those topical corticosteroids that are often prescribed for eczema? Are those safe for long-term use?
Topical corticosteroids can be very effective at reducing inflammation and itching, but they should be used, judiciously and under the guidance of a healthcare professional. Long-term use can lead to thinning of the skin and other side effects. There are also newer non-steroidal medications available that can be effective for some people.
Okay, so it's about finding the right balance between, managing the symptoms and minimizing potential risks. Now, moving on to another common childhood woe, tummy troubles.
Ah, yes. The joys of childhood digestion. From spit up to stomach bugs. It seems like kids are constantly battling something in their digestive systems.
It's true. Let's start with something that pretty much every parent has experienced. Spit up. When is it normal, and when should parents be concerned?
Spitting up, or reflux, is incredibly common in babies, especially in the first few months of life. It's often caused by an immature digestive system and the fact that babies spend a lot of time lying down, which can make it easier for stomach contents to, flow back up the esophagus.
So it's like a plumbing issue, not necessarily a medical emergency. But when should parents worry?
Well, there are a few red flags. If the spitting up is forceful or projectile, if it's accompanied by other symptoms like arching of the back, irritability, or difficulty breathing, or if the baby isn't gaining weight, it's important to seek medical advice.
Okay, so it's about looking at the whole picture, not just the spitting up itself. Now, what about stomach bugs? Those seem to spread like wildfires, especially in daycare settings.
Stomach bugs, or gastroenteritis, are usually caused by viruses, though bacteria and parasites can also be culprits. They can cause vomiting, diarrhea, abdominal cramps, and fever. And yes, they are highly contagious, spreading easily through contact with contaminated surfaces, food, or water, and also through, person-to-person contact.
So good hand hygiene is key for preventing the spread of those nasty bugs. What's the best way to treat a stomach bug?
The main focus is on preventing dehydration, which can happen quickly with vomiting and diarrhea. Offering small, frequent sips of clear fluids like oral rehydration solutions or diluted juice is essential. Rest is also important, as is avoiding foods that can irritate the stomach, like dairy or fatty foods.
So it's about replenishing fluids and electrolytes and giving the gut a chance to, rest and recover. Are there any cases where medical attention is needed for a stomach bug?
Yes, absolutely. If the vomiting or diarrhea is severe or persistent, if there are signs of dehydration like dry mouth, sunken eyes, or decreased urination, if there's blood in the vomit or stool, or if the child is very young or has a weakened immune system, it's important to seek medical care promptly.
Okay, so it's about knowing when to ride it out at home and when to seek professional help. Now, let's talk about fever, which is one of the most common reasons parents bring their children to the doctor. It can be so worrisome, especially when it's high or persistent.
Fevers are definitely a source of anxiety for parents, but it's important to remember that fever itself isn't an illness, it's a symptom. It's the body's natural way of fighting off infection.
So it's actually a good sign, in a way. It means the immune system is working. But when should parents be concerned about a fever?
It really depends on the age of the child and the accompanying symptoms. For infants under 3 months old, any fever warrants a call to the doctor. For older infants and children, a fever over 104 degrees Fahrenheit, 40 degrees Celsius, is generally considered high and requires, medical attention.
What about other symptoms that might accompany a fever? Are there any red flags that signal something more serious?
Yes, absolutely. If the child is lethargic, unusually irritable, not drinking fluids, has a stiff neck, a rash, difficulty breathing, or any other concerning symptoms, it's important to seek medical advice.
Okay, so it's about looking at the whole picture, not just the number on the thermometer. What's the best way to manage a fever at home?
The main goals are to keep the child comfortable and prevent dehydration. Offering plenty of fluids, dressing them in light clothing, and keeping their room cool can help. Over-the-counter fever reducers like acetaminophen or ibuprofen can also be helpful, but it's always important to, follow the recommended dosage guidelines.
And always consult with your pediatrician before giving any medication to a child, especially infants. Now, we've covered a lot of ground today, from respiratory illnesses to rashes and tummy troubles. It's been a whirlwind tour of common childhood ailments. But before we wrap up, I want to circle back to something you mentioned earlier, the development of a child's immune system. It seems like that's a key theme throughout all of this.
It absolutely is. These early childhood illnesses, while often challenging for both kids and parents, are actually crucial for building a robust immune system. Each exposure to a new virus or bacteria teaches the immune system how to recognize and fight off, those invaders in the future.
So it's like giving the immune system a workout, helping it build up its defenses.
Exactly. And while we don't want our kids to be constantly sick, a certain amount of exposure is necessary for their immune systems to mature and become, more resilient.
That's a good reminder for parents who might be tempted to overprotect their kids from germs.
Yeah, it's a natural instinct, but it's important to find that balance between protecting and exposing. A little dirt never hurt anyone.
And on that note, we'll wrap up part 2 of our deep dive. Coming up next, we'll delve into some practical tips for preventing the spread of these common childhood illnesses. We'll explore everything from hand-washing techniques to the importance of vaccinations and healthy lifestyle habits. Stay tuned. All right, we're back for the final part of our deep dive into common childhood illnesses. We've covered, a lot of ground: pink eye and ear infections to rashes, tummy troubles, and of course those ever-present colds and flus. But now that we've kind of explored the what of these illnesses, let's shift to the how. How can we as parents help our kids stay healthy and, minimize the spread of those germs?
Yeah, that's the million-dollar question, right? And while we can't completely eliminate the risk of illness, after all, a little exposure is good for building immunity, we can certainly take steps to make those sniffles and sneezes a bit less frequent.
Okay, so let's dive into those preventative measures. We've got some expert tips and some interesting research here that I'm eager to unpack. What's at the top of your list?
Well, it might seem kind of obvious, but hand washing reigns supreme. It's the single most effective way to prevent the spread of infection. But here's the thing. Most people don't wash their hands properly or frequently enough.
Okay, so a quick rinse under the tap isn't going to cut it. What's the gold standard for hand washing?
We're talking a solid 20 seconds of scrubbing with soap and water. And make sure to get all those nooks and crannies between the fingers, under the nails, the backs of the hands. It's those often missed spots that harbor the most germs.
Yeah, I like that visual, those little germ hideouts. Now, what about hand sanitizers? Are those a good substitute for soap and water?
Hand sanitizers can be helpful in a pinch, especially when soap and water aren't readily available. Look for alcohol-based sanitizers with at least 60% alcohol. But keep in mind, they're not as effective as soap and water at removing all types of germs, especially those that cause stomach bugs.
Got it. So soap and water whenever possible, with hand sanitizer as a backup option. What else can parents do to, keep those germs at bay?
Teaching kids to cover their coughs and sneezes is another big one. Encourage them to use a tissue or to cough or sneeze into the crook of their elbow, the so-called vampire cough.
I love that, the vampire cough. Mm-hmm. Much more appealing than coughing into your hands, which then touch everything in sight. Now, our sources also mentioned something about the importance of cleaning and disinfecting surfaces. How often should parents be doing that? What areas should they focus on?
Well, regular cleaning and disinfecting are crucial, especially in high traffic areas and on surfaces that are, frequently touched. Think toys, doorknobs, light switches, countertops, remote controls. Those are all germ magnets.
Okay, so it's not just about, keeping the floors clean. It's about those high-touch surfaces that we often overlook. What about cleaning products? Are there certain types that are, more effective than others?
Most household disinfectants will do the trick. Look for products that specifically state that they kill germs or bacteria. You can also use a diluted bleach solution, about 1 tablespoon of bleach per gallon of water. But be careful with bleach, as it can be irritating to the skin and respiratory system.
Right, good point. Safety first. Now let's talk about vaccinations. We touched on the flu shot earlier, but what's the bigger picture here? Why are vaccinations so crucial for childhood health?
Vaccinations are one of the most significant public health achievements in history. They've saved millions of lives and prevented countless cases of serious illness. They work by introducing a weakened or inactive form of a virus or bacteria into the body, which triggers the immune system to, develop antibodies to fight off the actual disease.
So it's like giving the immune system a sneak peek at the enemy, allowing it to build up its defenses in a safe and controlled way.
Exactly. And the beauty of vaccinations is that they not only protect the individual child, but they also help protect the community through something called herd immunity.
Herd immunity. That's a term we hear a lot these days. Can you explain how that works?
Sure. When a high percentage of the population is vaccinated against a particular disease, it makes it much harder for that disease to, spread. This protects those who can't be vaccinated, like infants or people with compromised immune systems.
So it's about creating a protective shield around the most vulnerable members of our community. That's a powerful concept. Now, I know some parents have concerns about vaccine safety. What's your perspective on that?
I understand those concerns. It's natural to be cautious about, anything we put into our children's bodies. But it's important to remember that vaccines undergo rigorous testing and safety protocols before they're made available to the public. The benefits of vaccination far outweigh any potential risks.
And it's about having those open and honest conversations with your pediatrician, getting your questions answered, and making informed decisions based on scientific evidence.
Absolutely. Trust your doctor, trust the science, and trust the decades of research that have proven the safety and efficacy of vaccines.
Okay, so we've covered hand washing, cough etiquette, surface cleaning, and vaccinations. Are there any other, preventative measures parents should be aware of?
One simple yet often overlooked strategy is keeping kids home when they're sick. I know it can be a logistical nightmare for working parents, but it's crucial for preventing the spread of infection.
It's always better to err on the side of caution, right? A day or two at home can prevent a whole classroom from getting sick.
Exactly. And finally, let's not forget about the importance of healthy lifestyle habits. Things like getting enough sleep, eating a balanced diet, staying active, and managing stress. All these play a role in supporting a strong immune system.
It all comes back to those foundational healthy habits. We can't underestimate the power of good nutrition, restful sleep, and a little bit of stress management.
Absolutely. By teaching our kids these healthy habits from a young age, we're setting them up for a lifetime of well-being.
This deep dive has been, incredibly informative. I feel like I've learned so much, not just about specific illnesses, but about the bigger picture of childhood health and immunity.
It's been a pleasure sharing this information with you. Remember, knowledge is power when it comes to your child's health. By staying informed and proactive, you can help your little ones stay healthy, resilient, and ready to, take on the world.
And on that note, we'll wrap up this deep dive into common childhood illnesses. We hope you've gained some valuable insights and feel a little more empowered the next time your little one comes down with something. Until next time, stay curious, stay informed, and stay healthy.